World Heart Day we started celebrating in the year 2000 at the advent of this millennium on 26th of September every year. Now, this is probably ironical to say that it meant that we are into an advent of the whole millennium of heart disease. It is impossible to believe the number of patients who have got both congenital as well as acquired heart disease, especially coronary artery disease, all over the world. Leading cause of death and leading cause of loss of productive years is heart disease today, especially in males who have to be the breadwinners for the family. We have got a big problem where they have got this problem, heart disease, and they are unable to look after themselves and look after the families. So some of these diseases, they have got preventable aspects. For example, if we take coronary artery disease, we have got what are called as modifiable risk factors. In modifiable risk factors, like somebody who is smoking or somebody who is consuming alcohol, somebody who have sedentary lifestyle, these are all the things which we can totally avoid, and these are all in our hands. If somebody has got hyperlipidemia or hypercholesterolemia, to take certain dietary measures, to have regular exercise, to eat sensibly, to keep their weight within normal limits, these are all the things which people should concentrate on. As a part of this World Heart Day of this year 2010, from Narayana Hrudayalaya hospitals, we have come up with a program called Karuna Hrudayam, which is keeping in tune with our motto of caring with compassion. Under this scheme, we are offering coronary angiogram for a throwaway price of rupees 4,500 only, all inclusive, for a period of 1 month from the advent of the World Heart Day this year. Similarly, for those who have been diagnosed as patients of coronary artery disease, we are prepared to do coronary artery bypass surgery for 95,000 rupees, all inclusive in our hospital. Similarly, for all the ESI employee state insurance scheme card holders, as well as for the Andhra Pradesh state government employees and for the members of press club, we are prepared to do a basic heart check totally free of cost for this month. We appeal to all of you to use this and to find out whether your hearts are all okay. And for the benefit to prevent this heart disease or prevention, that is the most important thing which all of us should really aim for, and prevent cardiac disease, and unfortunately if somebody has, at least modify their lifestyle such that everything is under control. Heart disease, rheumatic heart disease is a condition which is very common in India and in neighboring countries of Asia. One study showed that 30 to 40% of cardiac admissions into any tertiary care hospital are because of rheumatic heart disease. This rheumatic heart disease will start because of a streptococcal throat infection in childhood. All of us keep getting streptococcal throat infections, but for some reason, some of us are predisposed where this antigen of the streptococci will bear a similarity to the antigen of joints and also to the heart valve. So they tend to develop arthritis, and then some of them, they tend to develop what we call as carditis and valvulitis, where valve actually gets affected. Over a period of time, several attacks of rheumatic fever means that the child is crippled, can't walk, will get admitted into hospital several times, will finally have his arthritis part cured, but carditis will persist and progress into valvular heart disease. That produces narrowing of valve and leaking of valves. There are 4 valves in heart, but that can start as early as first decade of life. And we have seen and operated on children who are in second decade of life, which is really sad because they have to take medicines for the rest of their life and their quality of life becomes less. Because of lack of awareness, because of overcrowding, lack of nutritious food, lack of vitamin A rich foods, these are all the causes of high prevalence of rheumatic heart disease in India.